welcome to another episode of Wellness Watch. I'm Dr. Lauren Carroll. I am a physician executive, minister, and speaker, and I'm so happy that you're here just joining us today. And the purpose of Wellness Watch, the Wellness Watch podcast, is to educate, inform, and inspire you to live the life of wellness that God has created you to live. And I'm so excited today. I've got a special treat. I've got a very special guest that I'm super excited to introduce her. But first off, I kind of wanted to introduce our topic before our special guest just really comes on. So today we are talking about generational health. And I'm going to repeat that again, generational health. And I know a big kind of buzzword these days, or buzz phrase these days, has been generational wealth. And when people typically talk about generational wealth, they're meaning that they're working and striving these days to get assets, something to pass on to the next generation. It might be their kids or their grandkids or even further. And so they're trying to really kind of erase the mistakes in the past that their parents might have made and make sure that the next generation is set up with some form of wealth. Well, let's talk today about generational health. And what I mean by that we as women, we really can dictate the health of our household. But if we're not doing the right things, we can really put a destructive patterns in our kids and even after that. So, I'm a Bible, I'm a minister, I said that. So we're going to start out with some scripture. So I want you guys to turn to Proverbs chapter 14, verse 1. And it reads, "A wise woman builds her home, but a foolish woman tears it down with her own hands." So powerful. So I'm going to read it again. 14, verse 1, Proverbs. "A wise woman builds her home, but a foolish woman tears it down with her own hands." And unfortunately, there's a lot of us who are tearing down our own homes unknowingly because we're passing down really unhealthy and destructive patterns to the next generation. It's not on purpose. It's because we're ignorant about some things, and sometimes we're falling back on what we learned. And if you look at my first episode, I talked about how sometimes we feel like some things will just happen to us, or happen to my mama, my grandmother, my whoever. It's just in the family. No, you might have risk factors for certain diseases in your family, but there's things that you can do now to help yourself and the next generation to live a life of wellness. All right, guys. So today we're going to be talking about generational health, and I want to introduce our guest, and I'm going to pull up her bio because it is so awesome. I want to introduce you guys to Dr. Heather Benson. Hey, Heather. And our good to meet you. I'm not saying I heard you for Kev. He's in the background. He's tuning up everything. But while Dr. Heather, she got her face show, I'm going to start reading a little bit of her bio. So Dr. Heather currently is in private practice in Indianapolis, Indiana. She is an MD, PhD, and her specialty is obstetrics and gynecology, or OBGYN. She's been working, or she got her start at Indiana University School of Medicine. But actually, let me go back, because we know each other from the illustrious Michigan State University. You don't agree? Why? So I've known Heather. She's been an awesome person. And like I said before, I don't, when I have guests on the show, I know these guests are educated, they're experts in their field, but they really care about people and they're very down to earth. So I'm going to finish reading some of her bio. So she is focused on gynecology subspecialties and complex gynecologic surgery. And she studied under the instruction of certified master surgeons with expertise in minimally invasive gynecologic surgery. And she earned not only an MD, but she has a PhD in biochemistry from the Indiana University School of Medicine. And one of her focuses was finding ways to prevent lung transplant rejection. And I just think she's just an awesome person. And she's going to talk a little bit about herself. She does complex robotic surgery, so that I'm not a surgeon. Y'all remember I'm internal medicine pediatrics. I decided real early I didn't want to be cutting on people like that. So, without further ado, let's welcome Dr. Heather. Thank you.
Always my honor. Thank you so much for having me. So I couldn't help while you were reading that scripture. I pulled it up in the Amplified because the Amplified is my jam. And so if it's okay with you, I'll read it in the Amplified really quick. And it said, again, please don't. The wise woman builds her house on a foundation of godly precepts, and her household thrives. But the foolish one who lacks spiritual insight tears it down with her own hand by ignoring godly principles. So when you it hit exactly to what we need to do, which is marrying our understanding of godly principles with understanding how we're supposed to take care of this body that he provided us, our temple, right? So, you kind of hit on it with doing what are the things that we can do as women, I want to say providers in the family, but it's like it takes a household, it takes a village, but that we can do to kind of set a standard of wellness, a standard of taking care of ourselves, taking special time that we need to run errands, do our devotion, whatever it may be, taking that time for ourselves. And then that way we're pouring into not only us, but we're pouring into our families, how we're, doing our diet, exercise, things of that nature, which I know we'll get into, but just really hit on it. And so I was like, ooh, that was good.
And I always like to just start things out in the foundation. If you can tell, Dr. Heather is also a minister. So all my guests will be ministers and things, but that this tends to, you attract kind of like the same type of people that you are. And I know a lot of our audience, like I said, we always look at, with this show, we're looking at health versus wellness. And, we're going off the scripture, beloved, we wish about, God wishes above all things that you prosper and be in health, even as your soul. And sometimes your soul can prosper. You could be prospering spiritually, but your health could be bad, and that's not well. On the other hand, you could have like extreme amount of health, but things are not going right mentally, emotionally, spiritually, and you're still not well. So we're trying to marry both of those so we can live the complete life of wellness. So thank you, Dr. Heather. I really do. Woo, it's so good. So I'm just going to get into it. I hate to, I'll be honest, sometimes when people have like medical podcasts or anytime, I know you've been to tons of lectures, they always start off with the bad, and I'm about to do it too, but it's okay. Just part of it. I hate that, but that's just part of it. And sometimes I don't like, going around the issue. Let's just start attacking it where we're at and just throwing out some statistics. So most common causes of disease in women, and this is from the CDC. Number one, heart disease, right? And that can be caused by high blood pressure. Number two, cancers. And, unfortunately, African-American women in particular have the highest rates of cancer deaths. Not rates of cancers, but cancer deaths. Number three is stroke. Number four, COPD, chronic obstructive pulmonary disease. Number five is Alzheimer's disease. So this is just women in general. And later, we're going to be breaking it down by generation because we're talking about generational health. And so I know for a lot of women, I am a general practitioner, but a lot of women don't have like your traditional PCPs, and they will go straight to their OBGYNs like Dr. Heather. So I know that Dr. Heather, along with addressing those OB and those GYN issues, I know that you probably address a lot of primary care issues as well with your patients. So I want to know, what are some of the common obstacles to health that you see, health and wellness that you see in your patient advocate?
Great question. It's one that I feel like we're always trying to gain more understanding of so that we can really try to find solutions, right? So probably I'd say the number one thing I hear most from my patients are, I'd have work-related barriers. I'm not to get the time off to get to my appointment. Or, I can only get so much time. So if there's any kind of delay, you're running for a delivery, anything, then it's going to set us back, or I might have to leave without being seen. They sometimes offices will give them points, and if you get so many points, then you're at risk of losing your job, right? So, that has a large barrier because the majority of our office hours are during patients' working hours. And if they are responsible for a family, they've had to drop the kids off, all these things, they don't have that time to really get to a physician to work on not only, whatever their concern may be, but what are the preventative things that they can do to prevent, future disease. So that's probably one of the largest things. Another one is transportation. So, I've really been a number of times, I have patients that I don't have a functional car. I had to wait for a ride. I tried to get the Medicaid cab, but they came 40 minutes late. So now I'm late to my appointment and now I had to be rescheduled, right? We hear that all the time. Or if you have to take 3 and 4 buses in order to try to get to your visit. So these are some of the very, the top barriers. Not only that, you look at, which you're going to be very well versed on, insufficient insurance coverage, right?
Oh, girl, you speaking my language already. You speaking of public health language already. Go ahead. I'll let you finish.
I can't count the number of times I've had to call and do peer-to-peers where you're having to call and talk to, insurance company. They'll get like a pharmacist or a physician that talks to you about why the medication that you're prescribing is not covered by their particular insurance, or why you have to first have another medication that you try before they'll cover the medication that you want. And that's even if the patient's already had that medication and they're using it in the past, it's working well, they don't want to change. We found something that's good, leave it. And then you still have to go through these things. So prior authorization's a really big deal. And financial concerns. So I've got that are like, Dr. Benson, what do I have to do? Like, could we do this one and not that one, because I can't pay for all of that right now. And so then we're forced to try to say, prioritizing what is most important in this visit. What do we need lab-wise? What can we postpone to a later date? It's a lot. It's a lot. Not only that, I mean, you got me started. So here you look at the healthcare system today, right? We've all had to live through COVID. Now we're seeing a lot of staffing shortages, and that's with physicians, nurses, PAs, MPs, techs.
Girl, more for your own thing. Quick story, because I'm a healthcare executive, right? Yeah, and when I was doing the clinical medicine, so I was a chief medical officer and whatnot. So we had medical assistants. Some people are like, during COVID, this is during COVID, even a little bit thereafter, and be like, okay, I'm leaving, it's stressful or whatnot. They didn't just leave our clinic. They left medicine. They would have not left work at the plant. I'm filming at Detroit. Like, they left medicine altogether just because of the pressure at that time. And like, you're speaking my language, because really what you're talking about are social determinants of health.
Yes.
And we know, particularly for Black women, the majority of the problems that we have and that we see is not like a level playing field, because we have all of these other kind of factors that we have to just think about before we can even get to a doctor. And even if we get to a doctor, is it a doctor that we trust? Is it, and what I've heard from a lot of women, and even some of the things I've read, some women feel like their doctors are dismissive. They're looking over their symptoms. They're not taking what they're saying seriously. Yep. And we know, statistically for Black women, even in a hospital, looking at pain levels, things of that nature, there's some distrust of the medical system. And, if you don't trust, and then if you don't have people there that you can trust, it's hard to navigate. It's
impossible. I mean, trust is the foundation of everything. If you don't have trust, what are you building on? It's a lot. I think along with that, when you talk about trust, that spurred in my mind the idea of this bias that we have. You got to look at, not only the implicit bias that we hear thrown around so much in the medical field nowadays, which is, if you have positive or negative attitudes or feelings or stereotypes to like a certain group of people, but even if you're not conscious about it, right? So you got that, or you got your explicit bias where you have all those same thoughts and feelings, but you are consciously aware of what you're thinking and feeling. And so I think, growing up in a household of psychologists and
How fun? How fun?
it was actually great because, it helps you to really have an understanding of who you are and who, how you relate to other people, I think is the best way to put it. So when I think about that and thinking about that in the household of bias, we all need to be aware, especially physicians or providers, like aware of what our biases. Because if you start to become aware of those, then you can start to address those. If you can address those, then you can build trust with your patients. And if you build the trust, again, you're starting that foundation that you need in order to make an actual difference in their care.
Absolutely. And I know I have a lot of folks in the healthcare field, physicians, nurses that will be following this show. And, there's many, especially for Michigan, well, it's mandated. We need to take implicit bias test. But even as someone who is as a minority, right, there are implicit biases that we have. But I will say this: I don't want everyone to get bogged down. Yeah, there's a lot of there are a lot of problems, but there is still it is not an excuse. We have an uphill battle. We've got these social determinants of health, and sometimes healthcare seems like it's just hard going in, and you just want to throw your hands up. It's not an excuse. Well, that's not an excuse. There are still doctors out there who will work with you. I'm sure a little bit. I'm sure a little bit. And they might not be able to see you within 2 weeks and any kind of call. That's what I list. Let's just be real. But there are those healthcare providers like Dr. Heather, because I don't do clinical medicine anymore. Talk about that later. But there are other great healthcare providers, physicians, or practitioners, and folks that are, actually Christian as well in the system that can help you, will give a listening ear. You just have to be proactive about it and do not, and be, and I always say, don't try to, there's so much information on our internet these days. I promise. There's no degree in WebMD. That's not really based in it. I always say, and I will say, you might have had some problems in the healthcare system before with the navigation, but all doctors are not the enemy, especially those of us who see Black or brown people. We're not in it for the money like that. We want to get paid, but we're not in it for the money like that. I just know that off the rip, okay? Because a lot of times, you're not really seeing that much. You're seeing some, don't get me wrong, because, that tuition, we'll get on data bill, right? Student loans, like how they paying off everybody, yeah. Now more stimulation. I don't not like that. But, I will say that you have to go in there with the open mind, and your doctor is not your enemy. Especially sometimes, even as a Christian, sometimes people want to vilify their doctors. Like, no, Luke wasn't wrong in there anyway. He was a doctor. And y'all don't stand on that. Luke was a doctor. Not all doctors are bad. Not all doctors are bad. And for us, because we are Christian doctors, we are following the Great Commission, right? And God will give us insight, and we pray over our patients and things of that nature. So, I want to make sure that those of you who are trying to navigate the healthcare system, do not give up hope, because there are great doctors out there. We're kind of talking a lot on that, because there's so many. I'll be like in church, you're like, yeah, you got to rebuke the doctor. Don't do that.
I always say God gives wisdom, right? So God gives wisdom through the Gospels. It's just like the man who, I often tell this story. I think I heard it from my mom. But the man who, was in a flood. And so he's there just like holding on to his, some piece of cardboard or whatever he could find floating around, saying, "No, will you please save me?" God sends a boat, and he's like, no, I'm good. I'm going to wait for SWAT to save me. And then God sends a plane, and he's like, no, he forgot to save me. And then, he doesn't make it, and he gets to heaven, and he's asking, God, why didn't you save me? He's like, I sent you all these resources, and you didn't take advantage of the resources. So I always say God God can work through us. We are vessels. We are his hands, his feet. We are vessels to be used by him. So, just know that it's much more intricate and complex than just trying to throw it all away.
And then one other thing, I'm glad you said that, because God will send you help, right?
Mm-hmm.
You need not get offended at the help God sends you. If they say something you don't like, they say something you don't want to hear. No, I said this at the last time. So serious. A lot of people, God will send certain people into your life, but because you are offended, and I feel like our society is very contentious these days. People complain a lot, and people are full of offense. And the offense, some of it, I never say offense is valid. You can have a disagreement with someone. Someone might have done something to you in the past personally, but if you're getting offended at random people on social media, you're getting offended at the doctor, you get offended at someone. But and you're offended at everything. Maybe the problem is you. And then a lot of times, people don't want to be challenged. So if someone challenges you with something you might not want to hear, and God is sending that person to give you a different point of view, hear them out. And a lot of times, like, I know with and I will say this, I'm not against natural medicine or anything like that. A lot of that stuff came from the earth, all these medications that came from the earth, but they've been manipulated, that kind of thing. But your doctor, when you go in there, we're giving you evidence-based medicine. We have to tell you, what studies have shown. We will tell you best practices. Now, will that always apply to you? Maybe not. But we know majority of the time, this is what we would do. This is the course of treatment. Everyone is an individual, but you should at least hear them out. Now, if you're with the physician who's very dogmatic, does not listen to you, is not going to hear or answer any of your questions, and you feel like it's their way or the highway, they're not willing to explain, okay, that's a problem. Because that's not a good practitioner. That's not a good physician. That's not a good physician for you, right?
Right.
But if your doctor is giving you, trying to give you sound medical advice, it's up for you to consider that. Don't make them the enemy. Don't make them the enemy.
It's always okay to get a second opinion. I tell patients all the time, there is nothing wrong with a second opinion because, again, evidence-based medicine, we all are individuals. We have different perspectives, so that's fine. The majority of the time, you're going to get the second opinion, and it's going to have some sort of alignment with the first opinion that you probably got. Right. But that's okay because we live in a country where you are able to do that. You have that freedom.
Yeah, that's a blessing, and I'm the same way. Please get a second opinion, please. Because I think it's more so. We're not perfect. We don't know everything, and it's cool to get another set of eyes. Maybe someone look at your case, and maybe that other physician can explain it to you in a different way that you might not have understood from me. So I get that. I feel like we're about to get off on a tangent. So let me reel me back. That's what. Go on my script. It's all that happens. So let me ask you. So we've talked a lot about some of the obstacles that Black women may have to actually find a practitioner and actually get to that health side of that wellness. So let me ask you, what are some ways that you think that Black women can better navigate the health system? I say Black women because, that's predominantly who we see, but just women in general. How can we better navigate the health system?
I always say, first and foremost, preparation and planning is key. So I tell my patients when they come in, I want you to come in with your questions. I want you to come in with your concerns, like have them written down either in a notebook. I like the notebook because I have one here. It's like, because you always in a notebook that has, you can everything organized. You can keep thoughts organized. But I know we live in an age of technology, so your cell phone is fine under the notepad function too. But just having that preparation, coming in prepared, helps the whole encounter be one that's going to be beneficial for you as the patient, and for me to be very efficient and effective with what I'm telling you from the provider perspective. So, I get a lot of patients. Well, I was watching TikTok, and what TikTok said,
oh, Lord.
but here we are. So I say, okay, Please tell me what the TikTok video told you so that then you give me the opportunity as the specialist to verify or to say, here's where that video went wrong and here's why. Because again, knowledge is power. If I can give you knowledge, I am empowering you. When you are empowered, you can make better decisions for yourself and for your family. So I say that's one of the big one is being prepared and planning. And then it kind of falls into like the shared decision making, which we are talking about in a second opinion if you need it. But, not only coming in and asking, hey, this is my problem. What do you think we should do about it? My job is to have all of the alternatives. Like you could do A, B, C, D, E, and then I can tell you why A might be better than E. But at the end of the day, you can choose because from your perspective, what do you think is best? If I did my job right and I'm telling you and educating you and giving you the information that you need, then you can make an informed, educated, intelligent decision.
Absolutely. And side note, I'm not going to hate on TikTok too much because I be getting some bomb recipes off of TikTok. No, TikTok. You learn some stuff on TikTok, a lot of stuff. But no, anyone can do a TikTok, guys. And unless you're actually researching that person who is giving you this advice, a lot of times people out here just sound confident, like they know stuff. They don't know anything.
And it's the truth.
It's true. So it's nice, Dr. Heather, that you actually, you acknowledge, most people will acknowledge what you heard on TikTok, but then also verify with your doctor. And then and a lot of people, I want people to do their own research. Please research this. Be educated yourself. But then again, get an opinion for someone who has studied in this field, who sees these conditions all the time, and get their opinion as well. And I think just what you were saying is we just want people to get the whole picture so they have all these elements to make an educated decision, And I get it. A lot of people are used to getting scammed. There's so many scammers out here. There's a common distrust of just medical field. But, we want you to be an educated consumer. And that's with anything, not even just medicine. And know that there are doctors and practitioners and nurses that want the best for you. And it's not about money. Because I'm going to tell you, just like I used to tell people, it's like, if I really wanted to make like a lot of money, like I probably wouldn't have gone into medicine. And I say it in such a way because there's things that you can do that don't take up all of your 20s that you can make a lot of money doing and work probably not half as hard. I have areas, but we need to use show just about getting to like healthcare field. Let's do it later. But I will say one other thing I wanted to add. I love the fact that you said come prepared to your doctor's office. I always say, with managed care these days, your doctor does not have all day to sit with you. I know you would like that. And, you should not feel rushed. But I always say this, when you're making your list, pick out the top 3 things you want to discuss, like the make or break, the things that I need to discuss this before I need to feel like I've gotten a good appointment. So when you go in there, you got like 10, 15 things. You can't address all that in about a half an hour. Your schedule just can't do it. Exactly. You got your schedule. So I always say to hit at least the 3 top things. If there's other things you need to hit, that can wait till the next appointment or schedule another appointment soon after, probably within the next like 6 to 8 weeks to address those things. And then you'll probably, especially if those 3 things, you'll probably want to follow up on those things if they're very pertinent. So, all right. Yeah, all right. We are moving right along. So another aspect that I really wanted to hit with this topic. So we're talking about generational health. And generational health, you want to make sure that you have the right information. So that's why we went in to just doctor's care and how to navigate the system and things like that. The first thing is I find that, and I don't know, Dr. Heather, if you've seen this, I see this more so with men. Sorry, Kev, that's what I said. Sorry, but I see this more so with men. Like they want to neglect going. Yeah, true fact. Serve an actor, right? But unless something gets to like you long advanced and like, okay, that affected my quality of life, so now it's a problem, right? But we want people to be more proactive about their health, and that's not running away from the health system. All right. And so now I kind of wanted to kind of shift focus a little bit, because I've seen that sometimes we want to break down just the health and the screenings that generationally people should get. And let me just go over, when I say generationally, like we know kind of like the typical ones, like millennial, like I'm a millennial. I know millennials. Right. But, I wanted to start off even with Gen Alpha. We got Gen Alpha now. Their Gen Alpha is just turning about like 13, 14. Yep. And so those are the kids that are born between like 2011 to about 2025, right? So some of the kids that have not been born yet, they will be included in that Generation Alpha. And then we got the Gen Zs, and those are the folks born 1997 to about 2012. And then we have millennials, and we're about 81 to 96. We're not going to tell you we're not far along. I'm talking about that. Right. We be on the spectrum. We on the spectrum. Okay. 81 to 96. Keep it guessing. All right. But in some folks, I was Gen Z. I'm like, nope, I'm not doing. But thank you. And don't even. Thank you, though. But thank you, though. All right. Thank you, though. And then we have Gen Xers, which are 1965 to 1980. And then there's baby boomers, 1946, born between 1946 and 1964. And why I hit all of those, because you might be a millennial or a Gen Xer watching this podcast, but you're taking care of someone in a Gen Alpha, in Gen Alpha. Or you're taking care of maybe a baby boomer, right? And I think it's like the silent generation. I think before then, like folks in their 90s or whatnot. But you might be taking care of it. So I think it's good to address what are the needs of each generation. And so I wanted to start off with Gen Alpha, and I kind of looked this up. Some of the main concerns with Gen Alpha, those are our kids, obesity, mental health. We'll talk about more of this with Gen Z, but the mental health aspect of it, this is one of the first, I think this is one of the first generations growing up with AI, and then being screened. And, the thing about social media, we can see that in even our Gen Zs and some of our millennials, it brings a lot of mental health issues because of the social isolation, and then also some of that interaction. And, a lot of times, I'll tell you, when I'm looking at, kids that age, I'm a pediatrician, you should not be looking at social media like that. Oh, no way. Serious. If you have a child, should not be have no account. No TikTok. Because you don't know what those people got on there. As a Christian, they be having open Samsungs and all kind of stuff. You don't know. You need to know what your kids are looking at. At least we added and like adding on to that, like that in that generation, the Alpha, they are the age of, like you said, with like they have a lot of screen time, so we've got to monitor their screen time. We've got physical activity for them, because they're used to just being in. I mean, they lived through all of COVID. This is the generation that has active shooter drills at school. I mean, it's like that we didn't really have. And so it's like, they're going to have more expectations of healthcare as they progress up through the ranks. They're going to expect that you're going to deliver. You say you're going to do something, deliver on it. And you're going to do it efficiently and quickly, because we don't have all day. We have screens that we can find everything we need to know. So we got to be ready. Exactly. And I'm not a parent, but I work with parents and stuff all the time, right? But one of the things I see, I work with kids and parents all the time, but one of the things that I see is it's okay to say, I don't know, if your kid asks you a question. It's okay to say, like, I'll get back with you. Yep. Because if you just cut it off and I don't know the answer to this question, so I'm going to dismiss you, I'm going to cut you off, find the answer somewhere. Now, will it be true or not? Maybe not, but they're going to find it somewhere, and it might be coming from a source that you don't like. So Yeah, TikTok. Exactly. Again with TikTok. And I didn't plan to talk about it this show. We have ACEs, right? ACEs is adverse childhood events, adverse childhood events. And the ACEs study, and maybe I'll talk about this at another show, but basically it's childhood trauma that affects adult health. So if you experience like any violence or even divorce or anything like that that would traumatize you, or you've experienced yourself, or you've been a witness to it, a bystander, because there's a bystander effect. Some of those things that they're held down, if they're not talked about, if there's no counseling, therapy, or whatever, that could actually turn into diseases like heart disease, COPD, hypertension later in life. So ACEs, that's a whole show by itself. Right. So we find that we really don't address these issues in that early childhood phase. They become bigger problems afterward. So that's Gen Alpha. Now going to Gen Z. Now what's quite interesting while I was looking up Gen Z. So some of their common health issues, like the major one, anxiety and depression. Major issue within our Gen Zs. So Dr. Heather, what do you think when you're seeing a Gen Z patient, and sometimes there's this argument like, oh, remember like the Gen X and baby boomers, like, oh, millennials, they're probably, I don't know, and sometimes I see that. Well, actually, I'm gonna let people know. Sometimes I love my Gen Xer, I love my baby boomers, because more so baby boomers. Everyone like underneath the age of 40, they be thinking like, oh, it's a millennial. Those 45-year-olds are not millennials, okay? Millennials are in their early 40s, all right? Because they always want to blame millennials. It's like, it's not millennials. Okay, but anyway, what are some tips when you're interacting with some of your Gen Z patients? Are there certain things that you have to build a rapport, certain things that you have to do?
Yeah, so that's going to be like right around 12 to 27-ish years old, right? So they are very good at spotting a fake. I'll put it that way. Like, all insistent, genuine. Connect with them. Like, it's not a forced thing. You just sit and talk. You share the information that you have. They respect when you respect them, right? So I'm giving you health information. I'm giving it to you just like I would give it to anybody else, because you are old enough, you are intelligent enough, and you have the capacity to understand all the things that I'm saying. So usually I just deliver it just matter-of-factly. And then sometimes you have to be a little bit more open-ended with the questions, like, just kind of let things flow a little. This is that age when you start getting into, like, of course we're doing the flu and all that, but you're talking HPV vaccines. We're starting that with the patient and the parent in the room. You've got your STD screenings and Hep C starting to kind of address. And sometimes that can make this generation feel a little bit uneasy. But again, in my line of work, because I'm an OBGYN, I talk about sex and STDs all the time. So I'm very comfortable talking about
better all the time. And there's some wild stuff out here. Different wild stuff out here.
So you gotta talk about them. I usually have a talk, about watching out for STDs and, taking care of your body, not giving in to peer pressure and things like that. But yeah, those are kind of some of the main things. You got your diabetes screening, lipid screening, and all that stuff.
No, but that's actually what I was going to hit on too. Your typical screenings, like you already said, the STD screens or whatnot, and then you're starting to look at diabetes, which is typical of like primary care as well. And then if you were in a position where you were a parent of someone that is in Gen Z, just like what Dr. Heather said, this generation really loves authenticity, as we all should. But I find that millennials and up, we're kind of used to that parent-child kind of doctor relationship, and then, honestly, it's not like that anymore. And honestly, sometimes I admire Gen Zs because they are so bold to, they don't have any qualms about asking you questions and being intrusive a little bit, they don't have to, I have to do some discretion. I will say I got some of the dolls, but that's okay. Yeah. But I do admire their boldness in certain areas because they really want the authentic. And just when you're interacting with those folks in your family, or you're trying to mentor that generation, or you are a part of that generation, you're talking to your peers, just let's be authentic. Just be authentic. Right.
Oh, all right. Well, okay. So listen, cervical cancer screening of that group is like 21. That starts cervical cancer screening. So every 3 years till you get 30.
Every 3 years, so you get 30. And like I said, that's a time where you need to be, you're kind of entering the healthcare arena without the help of your parents. And you have that responsibility, and if you are married or in a long-term relationship, you're also looking out maybe for the health of your spouse, that kind of thing. So you want to make sure that you are taking care of yourself. I always say this, what you do at this age is really going to determine, what you do in your 20s, and your early teens, really determines what kind of health you're going to have in your 30s, 40s, 50s, and beyond, because it's those healthy habits, exercise, eating right. You need to establish some kind of routine now, so then when you get older, you got to change it up a bit because your body changes. You'll be used to it. You'll be used to working out your body. You'll be used to moving.
Agreed.
All right, so let's move on. We're going to talk about millennials. All right. some of our common things. I don't know. I feel like I love this meme that goes around. It's like you're at the age where you got some of your friends, you got kids that are graduating from college, and then some of your friends have like newborns. Literally. I mean, that's what it is, and I don't know why this is, and I don't see why it's such a new thing for us, because I know my grandmother, she was having kids like well into her 40s, right?
Yeah.
And in so many generations previously, that's just how it's been, and even more so with more women, particularly Black women, staying in school, getting degrees, getting married later. Yeah, many people will start their family maybe even in their 40s or even late 30s. So, but there's common health concerns with this age group as well. We're looking at the things like heart disease. Man, how sad is it when I remember my first time I had I think she was like 36, 37 in the ICU after a heart attack. And I'm just like, you're like 36, and it hit home because I'm like, man, we're not that far off. Yes, at all. You're having all of these issues. But, there's the common things, obesity, and again, anxiety, depression, which a lot of times that mental health will fuel some of the negative habits that you have physically, right? High blood pressure. I'm trying to give me some other ones. Give me something. What kind of things do you see in millennials? You just think that had to go to address?
Screening-wise, it's the big one for us because that's when you have to start doing your mammograms. And that is huge, right? And it's one of those things I feel like we sometimes we just fear as women. You're like, oh, I don't want to go do that. I heard they smush and it hurts and all this. When I hear that, I always say, but it's better than having breast cancer. So if we can hit this early, and get biopsies if they're needed, ultrasounds if they're needed, whatever, and get your treatment started, it can significantly change the trajectory of the rest of your life by just doing this simple screening. So, and that really goes for all screenings, right? It doesn't have to be specific to that one, but like the preventative care is what's really important. I tell people all the time, the emergency department is not the primary care office. That is the place you go to when you think, I might die today. Let me go and get help, right? Thinking there are ways. Go to your primary care doctor's office or go see your specialist for the various needs that you have so that they can address those needs. In the emergency department, their goal is to say, hey, you're going to live. Now you will live to get to your other doctor so they can take care of your specific problem. That is it. So I think if we continue to have a good understanding of, what do the different places represent and what is their goal and their focus, then we can better use our resources, which goes into the navigation, like you were talking about earlier, of the healthcare system.
Absolutely. And I'll just say this, that they know you over at your emergency department, that's not a good thing. They know you up in there too. I'm not supposed to know you like that. They're not supposed to know you like that. They're just not. And, and like I said, I can understand how hard it might be to get into your doctor's office or get into a good appointment, but it just starts with making that appointment. Even if it's like, if you have a particular doctor that you want to see and it's 6 months out, sometimes you just got to plan ahead. And sometimes if you have a MD or whatnot that you want to see, they might have a nurse practitioner or something or a mid-level underneath them. And like, Patrick, I'm not, I know there's an argument. Oh, mid-level, you got an MD, there's big stuff. We have to work together. Yeah, I love the nurse practitioners. I love mid-level, right? Because they're part of the healthcare team, and just know that, you can request to see your doctor, but just know that it might be a little bit until you see them. But if you have something acute, something, you're asthmatic and you need to get in or whatnot, you can go to the urgent care. And honestly, I'd rather you go to the urgent care than the emergency room. This is something minor. You just having a slight exacerbation or something like that. But really, if you're getting into your appointments and you check up, we would hope that we keep you out of the urgent care and keep you out of the emergency department.
You've got access now to a lot of the telehealth visits, right? So we've kind of opened up a whole nother realm of, yes, it still may be a long wait, but, if you're willing to go that route, that might, add another avenue of how you can get in and be seen sooner.
Absolutely. So I'm going to go next in our walk through the generations, because we want generational health. Gen Xers, right? So those are our folks maybe like mid to late 40s going up, right? You might have some issues, some of their common issues, stress and depression, and I think I see, right now I do like home health, and I see a lot of folks like 65 and up, sometimes in their 50s, and sometimes that age of retirement, especially if you've been working your whole life, and sometimes some depression, there's some depression with there because they're used to being needed, and if you're in that situation, we would never want you to suffer in silence. And I've seen that as well. There are rates of suicide and depression at this age, or I would say suicide, sometimes suicide, but substance abuse, that's what I was trying to get at, substance abuse and things of that nature. So that's one thing. If you're taking care of someone who is in this age group, or if you are in this age group, you need to really look at your mental health. And especially for that generation, that was the generation I'm going to keep it quiet. I'm just going to tough it through. And I always want to tell you guys, you're not weak. It's okay to talk to somebody. Please, talk to somebody. Therapy is okay. Therapy is okay. You do not have to suffer in silence. It does not make you a weak person. I think sometimes even as Black women, we have to put up this shield or whatnot because we feel like we don't want to be, you're not going to take advantage of us. We can handle it. We've been handling it. Yeah. We got this. We're strong Black woman. I'm like, man, sometimes I be weak sometimes. I'm saying, sure, I be weak sometimes. What do you mean? And of course, we want to call on the Lord. We want strength from the Lord. And yes, I would say, as a Christian, go to the Bible, and we've got the technology right at our fingertips. I want to do a word study on peace. It's all the scriptures. Look up all the scriptures on peace. Look up, if you're feeling afraid, look on all the scriptures on courage or bravery. As a Christian, that's part of our prescription, right? We're eating and we're taking the word of God. Now, along like that, God might lead you to go to a therapist because you have negative, destructive ways of thinking. That's just the internal
Therapists, Christian therapists are out there.
Yeah. So, and we're just, I'm saying all that, needless to say, and I guess I'm hitting the mental health so much because I find that the mental and the emotional health and the spiritual health affects the physical health but then also what you do about the physical health. Because if you are in a place that is so low that you don't feel like anything that you're going to do is going to help, you won't do it. So I can tell you, we can tell you all the physical things, to eat right, to exercise, to do all this stuff. But if you don't think you're deserving of needing help, or that you got it all together, or I've tried that, I've tried this, it's not going to help.
That's right.
Oh, and one more thing before I feel like I'm talking a lot. One more thing about therapy. If you don't like your first therapist, don't throw out the baby with the bathwater, so to speak. Find a therapist that you like. Maybe y'all just don't tell. Just like if you're going to see a doctor, you might not have good rapport with your doctor. Don't throw out the whole system. No, now people are different, you know.
That's right. Effort. I think it's about really putting some effort into it. You know, it's just like with anything. If you put your time and energy in, you will see the outcome. So it's like, you know, we have to care about our minds. We have to care about our bodies. And it all does start with our mind. You know, it's like, we're spirit beings living in a body, and we have a soul, our mind, our will, and our emotions. So, you know, it's like you got to take care of all that together, because again, it's all part of what God has given us to work with while we're here on earth.
Yeah, amen. That's so good. And sometimes I think we forget that we are the temple of the Holy Spirit. Yes, we need to take care of this house, this body. And just going back to the scripture, we need to be in health. Beloved, be in health. I wish that you be in health as your soul prospers.
Yes.
So your body needs to prosper more with your soul. So if you're doing destructive things to your body, you know, not overeating, not eating the right thing. Oh, somebody not about to not like me out there.
Just make a good plan.
Yeah. You could be praying in tongues, you could be laying, and that's you got it all spiritually. Yeah. But you feel like you overeat, you're an emotional eater. You got to combat that. And don't be mad when somebody say something to you. We're saying this in love, don't try to help you. God wants you to have a healthy body so you can continue to do those spiritual things. But you can't be running, laying hands on people, you huffing and puffing because, okay, I'm sorry. Never mind. So bad.
Understood.
I love you all, but I told y'all might not like what I said. That's a lot of it. Tell you the truth. I'll tell you the truth. All right, we got one more generation, because I know we could travel for hours, but we got out. So last generation is the baby boomers. And a lot of us out there are taking care of maybe our baby boomer parents, or you know, elderly loved ones and things. And, you know, my heart goes out to caregivers, just because sometimes it's hard as a caregiver, looking at the needs of this generation. And then sometimes this generation, I've seen like, they might be 80 years old. They're taking care of their 100-year-old mom or dad. Good team that are living that long, but they've got health issues themselves, trying to take care of that that family member. So have you had anyone in your practice of that age? What are some things that just women's health, you know, that they should be looking out for?
The thing we always talk about is osteoporosis screening. Like, that's huge, and that's getting your DEXA scan. That's usually around 65. Depending on what the family history is or what the patient's clinical history is, they might have to do that screening a little bit earlier. And then, you know, go ahead.
I was going to say, can you break down osteoporosis? I hate to interrupt you. Just break down osteoporosis and what the DEXA scan, the bone density scan is.
Yeah, so osteoporosis, that's dealing with your bone health. So you got to pull me back, because I start going PhD.
How to talk down the heart, walking on the heart, for that.
All these cells in your bones, some are bone builders, some are bone breaker downers, right? So the goal is to have the bone building cells continue to build. So that's why we talk about exercise, weight-bearing exercises, lifting weight. Mm-hmm. So you can get this DEXA scan, and what it does is essentially goes through, scans the bones in your body to determine, are you at risk of osteopenia, which is your bone density is decreasing, or osteoporosis, it's more significantly decreased, where now you need to be on medications or, you know, have a really strong active exercise regimen. So that's kind of it in a nutshell, is just you're trying to determine bone health and make sure that your bones are going to continue to be strong enough to support your weight and your body. So that's why we talk about, as you've mentioned with obesity, it really is important to lose weight. Like, it is a lot of extra on your body, not only physically on your joints, your bones, your heart, all of these things you need, your lungs, you need these things to survive. And so if you're just pounding on top of them with excess fat, that's just really making it harder for you to do all of the daily activities that you have to do in life. So it's a journey, right? We can't, it's just the finger. I know now we have Ozempic and all of these, Mounjaro, all these things that we're using, but it's a tool. It is not meant to replace exercise. You still need to exercise. You still need to eat properly. It's merely a tool to help you continue to move forward on that journey.
Absolutely. And honestly, one of our upcoming shows, we are going to have a weight loss and obesity specialist as well. So we're going to go into that too. But I love what you said there. You know, bone health is so important. And honestly, that's when you're a teenager, honestly. When you're a teenager. I'm not going to get into birth control and all that kind of stuff, but so on a lower bone that's you know, and one of the important things, even if you have like osteopenia, you know, it's supplementation, honestly. You have calcium, the vitamin D. And, you know, some of us, we live in, well, you know, you're in the Midwest as well. I know Michigan, 9 times out of 10, this is not a statistic that I have proven, but it seems like 9 times out of 10, yep, you are vitamin D deficient. Okay. We need it. I'm vitamin D deficient. I want all the time every day. You don't get outside in the world and I have fun. You're working. Yeah, I know. And like you got, people don't know your body will make vitamin D. If you're in, and it's actually the sun that you get too. But we ain't got on Michigan or Indiana. So one thing that I find, I supplement, and then I know there's some people will be like, oh, you don't have to take all those vitamins and all that kind of stuff. Personally, I notice a difference in my body because, you know, and I eat pretty fairly healthy, you know, I'm fruits, vegetables, that kind of thing. And I know that our soils are not as nutrient dense as they were, you know, years and years, hundreds, maybe again 100 years ago. So I know that there's things that we need to supplement. There's things that my body needs that I'm not even getting through the foods that I eat. Now I'm gonna tell you, I was a food science major at Michigan State. Now I know, okay, I know I know, right? There are things that were, you know, every supplement. No, it is not. Anyway, okay, so we're getting the countdown. Well, I know Kevin's like, we have talked so much. And Dr. Heather, I'm definitely gonna have you on for another show to talk about some other aspects of women and health. But I just wanted to say, anything lasting that you'd like to say, anything that you want to leave our viewers?
Yes, as we were talking about being proactive about our health, talking is what helps, right? Talk to your friends, talk to your family. The more we have this dialogue of health started and we continue to discuss it with each other and our providers, that goes a long way in terms of improving our overall health and how we feel.
Awesome. And I echo the same sentiments, you know, talk, don't suffer in silence, and don't feel like you are ignorant. You're only ignorant if you don't ask your question. All right. Thank you for joining us for this episode of Wellness Watch. We want you to prosper and be in health, even as your soul prosper. Join us next time. You guys have a great morning.